Good morning, all. Today we look into low backache and how and when to meet a doctor. Low backache is actually considered one of the prime causes of diseases that causes disability worldwide. And it ranges from a range of people from the age group of nearly 12 to 13 when they start the menarche until the age old group. So what happens is there is a lot of functionality variation that happens during this age group. And low backache can be considered in different angles also. When it comes to just low backache itself, there are many diseases that can be attached to it. And so we'll just probe into because many a times actually there are instances in the clinic when we look into the musculoskeletal disease clinic itself, you see patients telling that they didn't know when actually they should have met a doctor. So what happens is ultimately when they reach to us, it is in a stage where it is very difficult, or it would have come to a progressive state wherein the coming back is actually very prolonging or very difficult to cure. Sometimes it becomes in a state where you will not be able to cure at all, just that you will be able to maintain the status. So here we are trying to actually put up a status on low back ache so that you understand when you should be meeting a doctor and the importance of why is it necessary that you should immediately take care of the conditions prevailing also. So we'll go stage by stage. On to the next slide, please. So first, just to brief on pain, we actually consider even a low back ache or any type of ache that comes is mainly due to two problems. Either it can be like a very acute pain, which actually is like a sudden pain that actually comes to us when you are traveling, or suddenly when you lift a heavy weight in an irregular posture. If you're actually taking a pail of water or a bucket of water, and then if you have to actually shift things suddenly which you are not used to, and for people especially who are not used to exercises, I should literally say that, because that actually creates such a jolt on the body that it can create a very sharp sudden pain. And then other reasons, like on traveling, like you are actually taking up a very wrong road, that is a rough road, or especially in this scenario you can see many roads which are actually rough. And then in a jolting vehicle, which the vehicle is actually like in a like a bullock cart or a horse cart, if you're actually taking some short distances also, these can also create a sudden pain because the body is not used to it. And then the reasons for acute pain comes by injury. So injury can happen like all of a sudden as a accident. It can be sudden. You cannot control that instance, or by habitually, just by in a sports, like you are playing and you instantly fall, or at home there is some water, then you just slip and just have a fall on that. So all these actually comes under the acute type of pain. So it actually creates a shudder in the body, which creates a pain pathology immediately. Okay. And the other type is the chronic pain. Chronic pain is anything. It's like a very mild, it's like the pain persists longer time, but at the same time, it is not very profound that you have to meet the doctor immediately. So what happens is people keep along, and then it goes on, and any pain that lasts more than 3 months is actually considered as a chronic pain. Next slide, please. And so as you see in this picture, we're now going to concentrate only on that red part that actually have marked it up, so that we will be able to better understand as to, because this is a very common site of pain, seen in many cases, I should say. And this is the most undercared, I should say, that because this is a pain which can come physiologically and also psychologically, but never taken care in the right way. So we'll go to understand first what are the causes that can actually create such a type of pain. Next slide, please. So first, to understand this, the low back ache will actually show up as a dull ache. Generally, in most of the cases, the pain will be a dull ache. Dull ache means it will be a very non-nagging pain. No, it will not be nagging. It will be like very silent, but at the same time, you know that you have a pain at one point. And then it goes to a next stage wherein you have a stabbing pain. The stabbing pain is a situation wherein the type of prognosis is actually delayed, and at the same time, the pain factor is it's in a more aggravated form. And then comes a shooting sensation wherein you have to move your posture. It's like a person who's in sitting posture must be for 10 minutes he will feel only a dull ache, but at the same time after 30 minutes he'll feel the stabbing pain, and after 1 hour it will be a shooting sensation wherein the person has to literally move out of the posture. And then comes the difficulty. Now if you see, the third point is a difficulty in shift of posture. So when he's in a sitting posture, suddenly when he starts to get up again, there is a catch because the stiffness actually is very profound, and then he'll not be able to move from a sitting posture to a standing posture itself. So that transition of that posture is also very difficult in kind of low back ache. That stiffness will be much profound in the patient. Next is the hard to move or stand up straight. That is, if the person is actually sitting for quite long, then it is difficult to move from posture to posture. But if they actually standing for quite long, then it is difficult to move easily. That is, they have to literally give some time to think over and then move. So it literally like hard to move or stand up straight. Just like a jiffy, in people who have no pains and all, we just move from posture to posture in a very quick pace. That pace will be actually shortened, and that duration of the time for them to shift from one posture to another will also be it will actually be expanded. Next comes the limitation in range of movement. Now, for example, if it is since it is we are concentrating on the low back ache, the main range of movement is actually bending forward and backward. So in this case, the person will find it very difficult to fall for a forward bending or a backward bending. And even to the sides also, it will be very difficult. So this forward bending and backward bending is something that we actually is used in many functional uses also, like for picking up things from the ground, from the floor, or you have to actually carry something in a different posture. In all these, you have to move front, forward, or sideward, and all that. So these will actually be difficult for them. So what happens is the complete range of movement, that is, a person, if they're able to actually forward bend, it is almost like they'll be able to there is a different full angle that they can actually come down. But at the same time, in people with low back ache, they'll not be able to use the full range of movement. So maybe they'll be able to bend half down, and by the time they have a pain, and then they stand up straight. So that is actually the limitation in the range of movement. So the full complete use of the joint is not done. Then comes the functional disability. The functional disability is like the person wants to pick up something from the floor, but he will not be able to. Second thing is like you have to bend immediately for even just to escape a beat or something. That also becomes difficulty. Like you have someone coming to slap you, and suddenly you want to change from move over from that by bending forward or backward. Suddenly, if it is not possible, that also becomes a functional disability. And then whatever you are actually moving forward with to for carrying purpose, for shopping purpose, for traveling, or in all these, this low back ache actually becomes a functional disability. So this low back ache is actually to be dealt in a much more serious manner, because these are once there is a functional disability, people start becoming mentally also depressed, because for each and everything you cannot be dependent on other people. So that actually becomes a very difficult task, and psychologically also they get even more worse when it comes to that level. Next slide, please. So some of the causes are, the first cause is actually a very simple one. You have a muscle spasm or a sprain. That is the commonest cause that we see. People, even when we were talking about the different traveling type of jolting vehicles, or you are actually straining, like you're standing for quite long for some time, or you're sitting for quite long, you're in one single posture for quite longer period, then what happens is there can be a spasm or a strain that actually happens to the muscle, and because of that you have a low back ache. Second is a spinal osteoarthritis. So it can come due to a degenerative condition, also by age progresses also, wherein this osteoarthritis, or the kind of the degeneration of the spine actually happens, or the vertebra actually happens, and there is a spinal osteoarthritis happening. So that can also be one of the causes for low back ache. Next comes osteoporosis. Again, here the bone degeneration happens. It can be by the regular wear and tear, or by degenerative disease conditions like autoimmune diseases also. Next comes the bulged disc. So when you have this vertebra, in between you have the spinal disc also. So there can be many disc problems, like there is a damaged disc or a ruptured disc, and then the disc actually comes out. So the comes out of its position, that is a bulged disc, or a vertebral fracture. So all of this, a fracture is like, there are in many patients when they come to the clinic, when you ask them to take an MRI only, you understand that they would have had a fracture which has healed on its own, but in an irregular way. So that itself becomes a reason that there is a permanent low back ache that's happening, because the fused joint is actually not fused in the right way. So then comes sciatica. Sciatica is a condition in which you have a radiating pain. So there is a differential diagnosis that you can have either low back ache or the low back ache with the radiating pain. In that, it is sciatica that is getting affected. Next comes cancer. So there are many types of cancer which actually affects the spine, like osteosarcoma, like Ewing's syndrome, like that diseases. So in such conditions, you have actually one of the key symptom as low back ache. And apart from all of these, you have a psychological factor like anxiety, depression. All these can also create a simply, for example, if you are straining, if you're completely stressed in job, you can actually literally feel the pain in the low back ache. So these are also very important causes that could create a low back ache. Next slide, please. Now we come to the point where we actually deal with the topic. Here actually the background has been mentioned for why we should be importantly mentioning all this. Now in case of pain itself, there are many stages of the pain. So what happens is, in Ayurveda we understand this disease as kati graha. There is actually a graha, or a tightening of the low back, the whole of the pelvis. So that is how we understand, which actually creates a tightening of the joint. At the same time, it creates a disability in movement. That's what has been mentioned. But at the same time, the pain factor is very much variable. So in case of many diseases, many problems in a low back ache, you can see the first three, that is 00 to 02. It is actually from no pain to mild pain, which actually is a pain which comes and goes. So you have many diseases, or even in a fever also, like most of us have seen COVID and all that. So you have many type of pain which has actually manifested due to other diseases. So these can actually, the no pain, faint pain, and mild pain can come under that category, where because of some situation, there is a mild pain, and then it actually fades away after a period of rest. So this actually is you can actually consider this like a quantum, like your quadrant, I should say. In that first quadrant, you should be mentioning that this is a way that the body is reciprocating that you should start taking care of the body. Okay, next comes from 0 3 moderate pain, uncomfortable pain, and distracting pain. Moderate pain is in a situation wherein you have pain, but at the same time, because of some reason, like if you're so much engrossed in your work, or you get another type of work which is actually associated, you get distracted in a way that you forget about the pain. But at the same time, the uncomfortable pain and distracting pain is getting you to the verge that you will start thinking you have to meet a doctor. So the moderate pain to distracting pain, that is the point. So moderate pain, uncomfortable pain, and distracting pain. So moderate pain is that you are able to manage your all your routine activities, but there is a kind of pain which is always there. Uncomfortable pain is a pain wherein you're becoming uncomfortable, but at the same time you're not becoming dependent on others. Then comes the distracting pain, in which you are, even after trying other sources of distraction also, you are not able to take your mind out of the pain. So in all these state, this is a point where you have to surely meet the doctor. In from no pain to mild pain, the first quadrant, if you're able to start applying oil and all in your home itself, there will be much more a difference, that it will not take you to the next quadrant of moderate pain to distracting pain. Now, moderate pain to distracting pain is a point where you should meet a doctor, because once you have missed this, it will next take you to a distressing pain and unimaginable pain, wherein you are actually getting more distressed by the pain. At the same time, you're not able to manage also, just that you're not able to manage even the other functional activities. So it becomes that the pain is more serious in condition, intensity, the frequency also increases, and the condition becomes to a state wherein you are not able to manage it easily. So the condition is actually literally getting serious, wherein in Ayurveda, if we say, we should say we start giving OP treatment in the moderate pain to distracting pain. And when it comes to distressing pain and unimaginable pain, of course, you should need Vasti type of treatments also. Next comes the last quadrant, wherein intense pain, severe pain, and debilitating pain. See, in case of low back ache, there are situations wherein since we have the spinal nerves and all affected, it can lead to a situation wherein you are not able to move at all just because of the pain, and you are actually harming your functional activities. Like you get a food drop, or you get problems with the bladder, you are not able to control your bladder. So all of these can actually literally take you to the next stage of even a coma state also you can go, because the nerves getting affected. So these are all stages where you will go into an emergency. From the intense pain to the debilitating pain, there are always a chance that you will end up in a surgery or in an emergency. Next slide, please. Now, when you should be giving immediate care, that is, you have to run to the emergency when you have a low back ache along with a low bowel control or a bladder control. Here it is there is a neurological disease getting affected, and you have to meet the doctor immediately and go for a surgery. And next comes weakness of a leg, especially foot drop. And then comes the pain when you cough and pee, but that actually can be the much more managed. But the other two conditions are condition wherein either Ayurvedic treatment or allopathic treatment, you have to go immediately. Next slide, please. So now when we look into Ayurveda, how are we going to manage? We have actually different type of treatments. Like the first one now you see is just an oil massage, wherein you are completely applying oil on the body, which will actually impart more oiliness to the body actually, and take care of the neurological conditions. Next slide. So there are many types of oil that can be used, like coconut oil, sesame oil. Sesame oil is the most used. Then you can see some of the oils like Murivanna, Gandha Thailam and all, which is very much practiced in such conditions. Next slide, please. This is a type of this, when you see fermentation, sudation, it is actually a kind of heat giving process. So what happens is, when we saw a condition wherein there will be more stiffness to the body, we're trying to relieve the stiffness and heaviness by applying poultice, just like a bag completely packed with medicine material, or you're actually asking them to sit on a hot water tub, like, or many type of instances can be used. But in the idea behind is to actually relieve the stiffness. So you are actually giving them a warm poultice, or by a warm fermentation this happens. Next slide, please. Uh, Next, when we see, it's the lapum. The lapum is a condition in which we apply a paste, which is actually a fine paste of condition herbs, which will be applied on the body for a certain period of time. It will range from 30 to 45 minutes, which actually helps remove the inflammation condition. And there are paste, or the medicine is also different when we try to administer in a way that you're trying to support or stabilize the condition also. Next is a pichu. If you see in the other picture, the oil is actually applied on a hot. It's a warm oil which is actually soaked in a cloth. It's a cotton cloth which soaked in oil, and it is kept at the pain part. So it will be kept here for a particular period of time, which varies based on the patient to patient, and then it will be applied at the right point of pain. So the oil which is actually conducive to the patient will be used there. Next slide. Next is Kativasti. It's like a well type you actually make in with urad dal, and medicated oil at a specified temperature will be held on to for nearly 45 minutes. And this actually, the oil helps in literally being anti-inflammatory. It helps reduce the pain and strengthens the nerves in a much better way. Next is avagaha, in which you have a tub bath. It is actually a tub which is filled with water. It is either water, or it can be decoctions, or it can be oils, based on the condition of the patient. So you can see that the whole of the spine will be covered in such a tub. Next slide, please. So thank you for your patient hearing. For any queries, please log on to AVP Research Foundation. Thank you.